is that this is a unique time in Colorado. And it's a unique time in Colorado because you have a lot of people that have come to the table to try and improve the system throughout Colorado, the healthcare system throughout Colorado. And this task force is really a key indication of that. Through Michelle's leadership, we've really been able to start the valuable conversations about where the change can go, but there's a lot more conversations that need to happen. So as we explore options and opportunities, we need to hear from people who have firsthand experience in trying to access and use our current behavioral healthcare system.
And I'm a native Coloradan and have actually been at the state for probably 20 years or so, and really have never seen any kind of effort quite like this. And so I think it's incredibly significant.
I hadn't received therapy for about a year before I was hospitalized last year. And obviously I realized how important it is for me and how important it is for people with mental health conditions. I do not like saying mental illness because I feel that that's a little harsh, so I say mental health conditions. And in result of not being in therapy for a year, I was hospitalized 3 times within the course of 4 months.
What's so disheartening to me is that families with reactive attachment disorder fall through the cracks. It's considered to be rare, and it's rare in the general population, but it's not rare to adopted families or children in the foster care system. We work with families that are forced to turn over custody of their children to receive care. That is unacceptable.
Or I believe it was 2014, I was doing very, very, very poorly, anxiety to the point of vomiting multiple times a day. And eventually I found myself in the emergency room, and they didn't want to take me to a psychiatric facility because I wasn't showing signs of homicidal, suicidal ideation.
I remember one time when we were watching a family movie, eating popcorn together, not talking, of course, because we're watching a movie and she's texting with somebody. I heard something out on the front porch. And I got up and went to the front porch, and there's a policeman with his gun drawn because my daughter had been telling people that she was going to kill herself, and one of her friends had told her mom, who called the police, and so now we have the police and the fire department and the ambulance and everything. This is not the kind of response that de-escalates the situation. Another program that I think has been really helpful is the Law Enforcement and Mental Health Clinician Co-Responder Program. There are a few of them across the state. There's one in Eagle County now. So our more recent experiences with 911 calls to our home have been very positive when a clinician responds with law enforcement instead of all the rest. And they really do escalate the situation and are very helpful. So supporting those co-responder programs across the state.
Without a change to the gap in services, he just goes right back through the same thing again, over and over and over again.
So shortly after I turned 21, I attempted suicide. And I was suffering from depression as well as post-traumatic stress disorder due to a sexual assault that I had experienced a couple years prior. But unfortunately, I couldn't afford therapy or any medication. So my plan was basically to just keep going and hopefully my symptoms would go away, but obviously that didn't happen.
We sit in offices every week all over Fort Collins and Loveland next to families who have children there, both citizens and non-citizens, who have fees covered by services not available to our girls simply because we adopted internationally.
So back in 2011, I had a dissociative episode. The police came to my door. They took me to the bathroom. They took my husband to the living room and started to question us. I kept saying, I don't know what happened. Please let me talk to my husband. I don't know what happened. My arms are bleeding, everything. So the next thing I know is the female officer put me in a cop car and took me to the emergency room. I kept asking them in the emergency room, where's my husband? I don't know what's happened. They said I didn't need stitches. They asked me if I needed to go to the hospital, and I said, I need my husband. I don't know what's going on. Just please help me. So the next thing, they put me in a cop car and sent me to the jail. I'd never even had detention. in school. The ladies in the jail that knew me told me to go and appeal for like ROR. I didn't know any about this stuff. When they brought it down to a misdemeanor, the judge said that my situation was very complex, but my lawyer told me that we could go to court and fight it. And I said, you think that I'm going to fight this in a community that knows nothing about my DID? I'm a criminal now. I'm a criminal for my trauma. I'm a criminal for my DID and my PTSD. Why the hell am I going to go to and fight this?